So Perthes disease, as we all know, is the avascular necrosis of capital femoral epiphysis. And it's a self-limiting disorder, and complete revascularization occurs with ultimate healing. But whether the outcome will be Stuhlberg 1 with a congruous spherical head, or will it be Stuhlberg 5 with a deformed head which leads to osteoarthritis later, depends on certain factors, like the age of disease onset, the range of hip motion, the stage of evolution of the disease, the grade of epiphyseal involvement, and the extent of epiphyseal collapse or extrusion. So let's see what do we mean by this. So the radiological staging of disease evolution is well described by this modified Elizabethtown classification presented by Dr. Benjamin Joseph from Manipal. There are 4 stages, and each stage is further divided into A and B. So stage 1A is the stage of avascular necrosis. In 1A, the epiphysis appears sclerotic, but there is no loss of height. Whereas in stage 1B, the sclerotic epiphysis loses height and it looks collapsed. Stage 2 is the stage of fragmentation. In stage 2A, there is beginning of fragmentations which is evident by just 1 or 2 vertical fissures on the epiphysis. Whereas in stage 2B, there is advanced fragmentation and no new bone is visible lateral to the epiphysis. Stage 3 is the stage of reossification or healing, where early new bone formation is seen in stage 3A, and the texture of this new bone is porotic and it covers less than 1/3 width of the epiphysis. Stage 3B, the new bone is of normal texture and it covers more than 1/3 of the width. And finally, stage 4 is the residual or healed stage, where femoral head is fully ossified and there is no radiologically identifiable necrotic bone. Coming to the grade of epiphyseal involvement, which is well described by Cattrall and Salter-Thompson classification. The Cattrall classification is based on the extent of involvement of the epiphysis as seen on AP and lateral views, and this is applied during the fragmentation stage. So in group 1, only the anterior epiphysis is involved. In group 2, more of anterior epiphysis is involved and there is a central sequestrum, but the epiphyseal height is still maintained. In group 3, now most of the epiphysis is sequestrated and only medial and lateral epiphysis is spared, whereas group 4 is almost entire epiphysis is now sequestrated and it's an advanced grade. Salter-Thompson classification is based on the extent of subchondral fracture, which is seen as a radiological crescent present on AP and lateral radiographs. And you divide it as class A, where less than 50% of head is involved, and class B, where more than 50% of head is involved. Finally, the extent of epiphyseal collapse is described by this Herring's modified lateral pillar classification. What do we mean by lateral pillar? That's the lateral portion of the femoral head as seen on AP X-ray, which is demarcated from the central portion by a lucent line of fragmentation. That means about lateral 5 to 30% of femoral head. Again, this classification is applicable at the stage of fragmentation. Group A is where there is no loss of height of lateral pillar and only minimal density change is seen. Group B, where lateral pillar retains more than 50% of the original height with a width more than few millimeter and with substantial ossification. And group C, where lateral pillar retains less than 50% of the original height. There is something in between, that is group BC, where it is about more than 50% but with very little ossification or very narrow lateral pillar, or where is it exactly 50% but it is depressed relative to the central pillar. So again, re-emphasizing the prognostic factors. If the age is less than 6 years, the range of hip motion, especially abduction, is good. If the stage is up to 2A, grade Salter-Thompson A or Cattrall 1 and 2, and the extent of epiphyseal collapse Herring A, these are all the good prognostic factors in a case of Perthes disease. So understanding this basic now, I think now we can move on to how do we apply these principles in deciding the management. Over to Dr. Alaric Arujas. Thank you so much.